Welcome to Unhinged and On Call. I'm Dr. Chelsea, your resident veterinarian.
And I'm Trish, a registered vet tech who's seen it all. Each week, we're pulling back the curtain on the wild world of veterinary medicine, from late night emergencies to barnyard drama.
No filters, no fluff, just real stories, real laughs, and maybe a little emotional damage. Thanks for letting us share the madness with you. Welcome, everybody. Today, we're joined by a true pioneer in veterinary surgery, Dr. Dean Hendrickson. He's a professor of surgery at CSU and one of the early innovators of minimally invasive procedures, helping shape techniques that are now considered standard of care. For more than 3 decades, he's been at the forefront of advancing surgical medicine, training generations of veterinarians, and continuously pushing the field forward. We're honored to have someone whose career has helped define what modern veterinary surgery looks like. We also get kind of a nice personal touch from him just on some of his trips to Africa and some very close encounters that Trish has.
He is braver than I. I told him that. Like, he is a very brave.
We decided that on one of them, I don't know what I would do, but the Trish might faint. And
I'm an offering.
Would be a snack for this predator.
Just an offering to the lions. That would give the rest of my friends time to get away. So it's
just be
sacrifice to the
you're
lions.
The sacrificial.
Yes. So that'll make sense when you hear his story later because it's amazing. Yeah.
It's so funny. Yes. And crazy, really.
Yeah.
So stay tuned, guys. Thanks for listening.
You. This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
Thank you, everyone. Today we have a great guest, Dr. Dean Hendrickson. He's professor of surgery at CSU, and he's been there for as long as I can remember in a very cool way. There's very few people that stay at one place for long anymore. But he was a professor when I went through school. And one of my favorite labs that Dr. Hendrickson does was I don't know if you're still allowed to do this, but the laparoscopic rectal palpation.
Mm-hmm.
And so
we still do it.
God, that was amazing. Because as an equine practitioner, you can get a feel over repetition, but you get to see all the structures laparoscopically while you're rectaling a horse and just get used to normal, abnormal, like you have to know normal first, that kind of thing.
Yeah.
It's amazing to be able to see in there. So even yesterday I used that. There was like a case with way more small intestine than I've ever felt, in an older mare with a strangulating lipoma. And it was just great because I call on that all the time, and it's like 15 years later.
I love that.
So,
That's really cool.
Dr. Hendrickson, I think, was one of the initiators with laparoscopic standing surgeries in horses.
Wow.
Yeah.
So,
and that was one of the things that, we actually found out about the rectal palpation almost by accident. We were doing a surgical procedure in Wisconsin when I was on faculty there, and we had short scope and short instruments. And so we had invited one of the therageninologists to come in and lift the rectum for us so we could see across to the other side of the abdomen. And he's looking at the monitor, I'm looking at the monitor, and at the same time we say, we can see what you're doing. And we actually then started doing this because I think one of the biggest challenges is, for years we've been told you can feel this, you can feel this, you can feel this. And so when your arm's in there and nobody can tell where your hand is, you just start to nod your head and you're inside, you're going, I have no idea what I'm feeling. But if they tell me that's what I'm feeling, that's what I'm feeling.
Yeah.
And so we took this, and then, anytime you can add multiple senses to learning, you learn better. So in this case, it's not just feeling, but it's also seeing and then hearing me come back and confirm what you're feeling. So 3 senses, and it's astounding how well it sticks. So it was pretty cool.
That's awesome. Well, I love that. I mean, that's a lot of science, is like finding stuff kind of by accident.
Yeah.
But in a very cool way. Yeah. Well, and now I feel like there's so many minimally invasive surgeries for horses based on laparoscopic approaches. So it's really cool. It's shaped that whole segment of equine practice.
It does. And we just last week we had a case that was that, right? Hard to diagnose, not doing well horse. And we were able to put the scope in and get a really amazing exploration of the abdomen, came up with the plan and an answer. And yeah, I think the minimally invasive surgery has been such a positive side for us in the veterinary world, equine as well, but certainly many different facets.
Yeah. Yeah. Is anybody using it in small animal for?
Yeah, they're
Yeah.
doing more and more now in small animal as well. Again, started with a lot of the reproductive stuff similar to us, the
Okay.
ovariectomies, cryptorchidectomies, and
Okay.
then added into that the gastropexies and other things now as well. So
Cool.
it's a great way, right? It's a great thing. Minimize the morbidity of the patients. They go back to normal much more quickly, and it's
Yeah.
fun to see how well they do. I
Yeah.
think that especially for me, like with ovariectomies, traditional ovariectomies in mares, they'd stand in the back of the stall and hate you for 48 hours. I mean, they just literally, now they're eating within about 4 hours of surgery. They look like nothing has happened to them other than the incisions on their flank. And,
That's
and
incredible.
it's just been astounding to see that difference.
That's amazing. Just
Yeah.
increased standard of care too. Like
Oh.
that's so
Yeah.
that's really nice. Oh,
Yeah.
wow.
Yeah.
Incredible.
That's very
Yeah.
incredible.
Oh, yeah.
And one of the other, I know that you have a lot of, you wear a lot of hats and you're great at wound care and all that. But one of the other things that I'm sure a lot of people know about is just your work on elephants in Africa.
Oh.
Can you expand on that a bit?
Oh,
That's,
wow. Yeah.
I
Yeah.
don't remember what part it was, but you had a whole presentation for us as students, and that was so cool.
Yeah, again, minimally invasive surgery. So the idea is that we can make small incisions, do big work inside the abdomen. And so I was part of a team that developed an approach for a minimally invasive vasectomy in free-ranging bull elephants in Africa. So elephants have intra-abdominal testes. I didn't know that. I had to be told that because I was trying to figure out why in the world would use laparoscopy for doing a vasectomy.
Yeah.
So
Yeah.
brought that one out
You
after
just need a
being told,
ladder.
and
Yeah. A
yeah.
ladder. Yeah. Yes.
Well, we actually stand on the back of a crane truck. So that's
Oh,
the deal. So we hoist them in a truck. So we anesthetize them with the torphine, put them in a standing like position with straps, and then hang them from a crane truck. And then we do the surgical procedure from there. And it's really cool, right? Is you do this, what is a relatively major procedure
yeah.
in the bush of Africa. And within 5 minutes of being done, they reverse the elephant and they wake up and trottle off into the bush. And
Wow.
that's what's amazing by I think some of these minimally invasive approaches is just really gives us an opportunity to do some pretty incredible things in places that you just never expect to be, right?
Yeah.
Never once did I imagine I would be uh, looking over the back of the elephant and seeing a herd of zebra run by, or being
Yeah.
warned by somebody the lions are all around us in the bush, so you can't leave this little clearing, to snakes in the vehicle, lions in camp.
Oh.
It's
Oh,
one of those pieces of life that you just sit back and go, "Wow, that's just been pretty crazy."
wow. You're braver than I. I would.
Well, you had
Or
people,
dumber.
right?
Yeah.
Well,
Yeah.
no.
Yeah.
No. Did you ever have close calls? Like I assume you had people
Yeah.
on guard, like locals that knew how to keep everybody safe.
We did, and that was fortunate, right? They would help us out with that. But one night we had just arrived. So one of the reserves we were working on, we just arrived, and we were in a camp in the middle of this reserve, probably 40,000 acre reserve. And it's high fenced with electric fence, right? Or it's fenced with electric to keep out the predators.
Yeah.
And so one of the people on our team was asking about going for a run the next day and whether that was a good idea. And the guy's like, yeah, it's probably not a really good idea because we do have a lot of lions around here, but inside here, you guys should be fine. And no sooner, and it was just getting dark. They had a fire going. I mean, it's quintessential Africa. You have to
Yeah.
cross a river to get to the camp. So you drive through the river in your Land Rover to get to the camp. We're sitting in there. They've got the fire going. You travel for 20 some hours the day before, stay overnight in Johannesburg. It's a 6 or 7 hour drive. And
Oh.
so you're just relaxing and unwinding. And he says, you should be fine here. And no sooner had he said that than we hear a noise on the other side of the fire. And he takes his flashlight and points it. And there's a lioness that has jumped the fence just on the other side of the fire from us.
Oh.
Oh.
And so we're all laughing about this, and they start yelling at her, and she runs off, and everything's going to be fine. And we realize it's dark, and the hut that we're staying in is a little ways from the fire, so we should probably go grab our flashlights to get there. So we walk over there, grab the flashlights, walk out the door of the hut, and the male lion starts roaring. And you've never been somewhere until you can feel a lion roar, right? You can hear lion roars, but in this case, he was so close you could actually feel him. His roar would reverberate through your chest.
Oh my gosh.
God.
And so turn the flashlight, and 15 yards away is this monster, probably 450-pound male African lion, who's also inside the fence with us.
Oh my God. Who has also jumped.
You should be
How
fine.
tall are these fences? Because I feel like we
Well,
need to.
we didn't know because it was relatively dark when we arrived. So the next
Yeah.
morning we found out that what had happened is they'd had a flood a week or so before, and it had pushed the sand up against the fence. So they literally could walk up on the sand and they'd just jump over this fence, which
Oh
was about
my
5 feet high.
gosh.
And it was shaped in such a way that it was very difficult for a lion to jump it any otherwise.
Okay.
But not in this case, not with the
Wow.
sand coming up against them. So this male had literally, when we were walking in the door to our hut, was in the dark about 5 yards from us. We didn't know he was there because he wasn't doing anything. And so at this point, we can see him clearly, and he's roaring. We can feel him, and he takes off after the female. She was in heat. His only interest was her. And so luckily, because if it had been something else, one of us would have been dinner.
That's a snack. Yeah.
Oh my gosh. That is crazy.
And there's just two of you.
I think there were 2 or 3 of us right then and there, but yeah, so your chances were pretty good being dinner at that stage. But luckily he wasn't. So the funnest part of the story, right, is that we realized very quickly he was after the female. We were fine. There was no danger for us. This happened to be the one place that you could get cell coverage in this deal. So I called my wife so she could hear the lion roar.
No way.
In the States. She thought I was a little bit off my game,
to call her first.
But,
oh my
she
gosh. Oh my God. I don't know if I'd be able to hang up that call. I'd be like, stay on the phone. Just so I know you're okay. Wow. That's incredible. Wow. I've never heard anything like that before. Wow. Oh my gosh.
That's wild.
Of course, that would be like my luck that there's some random sand embankment that just forms
the day you're there.
Yeah, exactly. What timing. Wow.
Oh,
so of course the next morning I was up early because I you've got jet lag, and so you wait till you don't leave the hut till it gets daylight because you've learned enough from the night before. But then I had to go figure everything out. So that's when I sorted out the sand and saw where the lions had come in and how he had walked right beside us, and all of these things as you start to piece the puzzle back together. We've had some fun. We had a snake in the car one time, a boom slang, which is one of the 10 most deadly snakes in the world. 18 inches from my face. He was coming between the dashboard and the windscreen in there. So that was interesting for sure. The one time we had the lions close by, and the guy just said, look, we can't, we've tried, we've drugged, we killed an impala and we tried to give them the impala. They won't eat it. Apparently they think you guys look better. And so he said, you can't leave the clearing. He said, I can protect you in here, but I can't protect you outside of here. So.
Wow.
Oh my goodness.
You're just going in for surgery and you get all sorts of other surprises. That's very cool.
Cow.
Yeah.
The snake is called a boom slang. Is that what you said?
Boom slang, yeah.
Boom slang.
It's an African tree snake. So the slang is a snake. Boom is a tree branch. So they live up in the branches. And they think what had happened is that somebody had been out the night before in this safari vehicle and probably were under a tree, and the heat was rising up and the snake dropped onto the top. They didn't know that, and then climbed down in near the engine compartment to stay warm overnight. And it was first thing the next morning we were driving. After a little bit, decided to come out and have a look.
Oh my goodness. Oh my gosh.
Wow. That's cool. But a great experience.
Yeah.
That's very cool.
Yeah. That's incredible.
And they're all tagged, like you're generally working in preserves. How did you not vasectomize another elephant or like repeat vasectomize an elephant?
Yeah,
Oh,
so
good question.
elephants' ears are much like humans' fingerprints. They're very specific, and these reserves know every elephant by the
Okay.
ear tears, notches,
Wow.
things that have happened naturally to them,
Huh.
right? So they don't notch them intently,
Yep.
but they'll have tears and other things, and they're
Okay.
very specific. So yeah, the helicopter would go up and we'd be after a set of specific bulls. And then just as the week went on, right, as we got more and more of them done, they'd have to work a little harder to
Okay.
find a specific one that we were going to do for that day.
Wow.
But they're amazing. And then helicopter pilots are crazy over there. They're literally absolute adrenaline junkies. They go places with helicopters that you're pretty sure no sane person would go.
Were you in the helicopter?
No,
No,
only
you
one time. Most of the
one time.
time,
Okay.
I was on the ground setting up all the equipment
Yeah.
and everything. So
Okay.
Oh,
one time I
wow.
got to go up in the chopper, and it was pretty fun.
Oh, that's a good question because in my mind you're like rappelling down
Yeah.
from the helicopter. So that's good to know.
sounds-
Yeah.
yeah.
Wow, that's crazy.
Slightly dangerous.
Oh my gosh.
Wow, that's so cool.
Do you have any like urge to do it again?
I'm sorry, what's that?
Do you have any urge to do it again? To go there
Oh,
again?
I'd love
and
to go again. I wouldn't
Yeah.
even hesitate.
Really?
I mean,
Okay.
Africa's an incredible place. I mean, it
Yeah.
really is. And the chance to be right in the middle of that, working on these amazing creatures is really fun. I mean, it's absolutely incredible. The legend in Africa is that you should never walk barefoot in Africa because the dirt will get into the cracks of your feet and into your blood and it never leaves.
Oh.
And it's true. I mean, I love Africa.
Oh.
It's absolutely incredible.
Oh,
And the thing is, I mean, most of the time, you know what it is that wants to get you, and you can pay attention to that and try to put yourself in as good a spot as possible
yeah.
to minimize that. And so
Wow.
we had some exciting times, but we probably honestly never really were within death's grasp of any of these. Just
Okay.
some fun stories.
Yeah. Yeah. Very fun.
Wow. Wow.
Did your wife ever get to go?
She did. She
Okay.
went on one of the trips that we went. We went, I think, 7 times altogether. So.
Oh. Wow.
So she went on one of the trips. We actually celebrated our 20th wedding anniversary in the bush of Africa. So that was
Oh,
pretty
That's
fun.
amazing.
That's
Oh.
a great anniversary.
Yeah, that's cool.
Yeah.
Yeah.
Wow.
I'm not sure she thought quite as much as we started, but I think by the time we were done, she also probably doesn't love Africa as much as I love
Okay.
Africa, but she really enjoys. And we then went back actually for a meeting some years later, and yeah, she really
Yeah.
enjoyed it as well.
Aw.
You get the dirt in there.
Yeah.
It doesn't
You got
leave.
the
Yep.
dirt.
That's
Yep.
cool.
I love that.
That's
Wow.
cool.
Incredible.
Well, and I think we kind of talked about it a little bit, but do you have any stories, I guess, from your career or highlights, things like this outside of elephants?
Right, yeah. I think it's one of the things, right? You start this career pretty much with a mindset of what you think you want to do and what you want to go. I tell you guys all the time when you're here as a student that my goal was to be a mixed animal practitioner in small town Montana, and I failed, so I had to become an equine surgeon. And I, it's tongue in cheek sometimes, but the reality was I had a hard time deciding what species I would work on because I really truly had the mixed animal mindset growing up. That's all I knew. I didn't know there was specialization in veterinary medicine. I just knew that you were a mixed animal practitioner and you might do more large animal or more small animal, but you did everything.
Okay.
So I came to veterinary school with that, fell in love with surgery. And so I think that's what really kind of guided me and had a faculty member that told me I ought to consider teaching. And I laugh about that now because it has been such an incredible career as an educator. But I actually said to him, I don't have a teaching bone in my body. I have no idea what you're talking about.
Oh, but he saw
And he
it.
was
You just
persistent.
didn't.
Yeah.
Yeah.
I just couldn't see it. I couldn't
Okay.
see it, what he was talking about, but he
Wow.
was persistent and he finally helped me recognize I could try an academic internship and see if I really liked it.
Yeah.
So I did. And I mean, I fell in love with it. Within a couple of weeks, I was like, what in the world was I thinking? This is so amazing. But now I'm panicked because I'm like, I'll never get a residency because this is, I haven't done anything to do this. And so I was very fortunate. I got a good residency and I've had just such an amazing opportunity. I've been here now almost 31 years, actually.
Oh,
In
gosh.
10 days, I will have been at CSU 31 years.
Wow. That's a huge
And
milestone.
It is.
yeah,
Oh my
it is.
gosh.
And it's been, and again, you look at this career and think, I have actually done veterinary work on every continent except Antarctica.
Oh man. All right, how do we do
Wow.
that
So
in 10 days?
Yeah,
I
yeah,
know
let's
exactly what
get
I'm
you
getting
there.
there. And so I think that's what's neat about this. And I think the thing I hope people will take from at least what I've done is the fact that there's a lot of opportunities in this
Yeah.
career, and you don't have to be defined by your understanding of the career. There's lots of places and ways that you can go and things you can do. I worked on species of animals that I never thought I'd see, much less work on.
Okay.
And I've clearly been places I never expected to go to. And so I think that's what's the neat part. And I keep trying to talk to students nowadays, and I'm sure you heard this from me too, Chelsea, was you guys can't think of us where we are now. You have to remember we were once you. No matter where you are, we were once there too. I
Yeah.
was once a first year veterinary student, right? I didn't come into this world with 30 years of experience. I came into it with zero.
Yeah.
Yeah.
And work through all of these things. My favorite line to students now when we do surgical skills stuff is, you have to remember when I was you, I wasn't me. I didn't have 38 years of surgical experience.
Yeah.
Yeah.
I had none.
You
And
start from
so
zero.
you do, and we all do that. And
Yeah.
I think that's so my hope is you can look at this and go, wow, maybe I can be something different than I think I am right now, and
Yeah.
give you great opportunities to do that. So I just think it's such an amazing career and opportunity.
Well, it's a great sentiment too. And I
So
think
nice.
we've even through this show, we just started in July, and we've had guests on that went through and were sure they were going to do either equine or cattle medicine. And one of them is actually a girl I've mentored, but she's now a prison vet for the A&M system, and she loves it.
Yeah.
Like
Yeah.
absolutely. And I mean, what random, facet of life was that?
I
She was like,
know.
I could have never imagined this,
Right.
but she loves it. And so I
Right.
think that, like you said, it's so the DVM degree and just veterinary medicine is so versatile that you can find your niche. Like,
Yeah.
Yeah.
and a lot of times it finds you. I don't
Right.
think most people go out looking
No.
for a specific setting. It just
No.
kind of happens that way.
Well, even me. I mean, that's exactly what happened to me, right? And as a technician, and I met Chelsea in equine practice, but then I literally do veterinary cannabis consults now, and I'm not in the clinic, and I own a company with Chelsea doing that. Like, I never in a million years would have ever thought that would be happening, but I absolutely love it, and I get to use my credentials in a different way that still contributes to animal welfare and, all the things that I intended them to. But it's so rewarding. So we all find rewarding, like you said, areas that just kind of fulfill us. And I think that's so wonderful. And I just would love to say real quick too, everybody is so lucky to learn from you. Like for you to talk about it in that way, it really means a lot to students to hear that, I think, and be able to relate to professors in that way, because I've had some that were like you and so wonderful and really, an honor to learn from, but also the opposite, that kind of made you feel small and not as, like not give you the room to grow necessarily because of their own thing. Expectations.
And,
Yes. So to see you and just hear you talk about that is incredible and refreshing. So thank you for being you. Yeah.
Well, it is cool, right? I mean, I think we all have these thoughts and ideas of where we are, and as we go, our eyes are open to new things. And that's the other thing I try to tell people is that if you're not in the right place, you're just not in the right place now. Find the right place.
Yeah.
It's okay, right?
Yeah.
You find that every year or so, in a week or so, I will get away for a day, and I ask myself two big questions, right? Is this the best job for me? And am I the best one for the job? And I promised myself that if I couldn't answer both of those with a resounding yes, I would change. And I moved down the administrative path a ways and ended up as the associate dean, and I couldn't answer those, so I came back. I came back to clinics. It wasn't the right fit. And I think that it's really important for all of us to recognize we're going to make some choices that we're like, I don't know if I would do that again if I had the chance. But what I'm not going to do is stay in it with and not be in the right place. And so
Right.
I think that's the other part I hope people look at, is recognizing, hey, you're just not in the right place now. Go find it.
Find it. Yeah.
Wow.
And so you've done that once a year, like usually at the start of the year?
Every year, every
Oh,
January,
wow. That's such a
I go
great
do
idea.
that.
I love
Yeah.
that.
Yeah.
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 My gosh.
I had a few people in my past that I have really respected that I think should have asked those questions
Yeah.
and didn't. And I promised myself that I would do that. I would
Okay.
know that it was the right for me and I was the right for it, because it
Yeah.
doesn't, you don't always match, right? Sometimes you might be the best person for the job, but it's not the best job for you, or,
Okay.
or vice versa. And I think that that is the piece you just have to recognize, that both of those are important. And I
Yeah.
think finding that spot is good. And as I say, I am incredibly fortunate. I have just had probably one of the best possible careers I could have ever fathomed. So
Yeah. Well, but I think it was active. Like you found out you didn't like administration, or it wasn't
yeah,
a perfect fit. And so just recognizing that, and not, I think a lot of us get caught up in the day to day and you just keep spinning your wheels.
Yeah.
And you have to check in and protect yourself. Cause I
Yeah.
think, I mean, as Americans, we are used to just grinding.
Yes.
You know,
it
and
is
Yeah.
true.
continuing on
Yeah.
a pathway. So
Mhm.
I really like that check-in. That's,
Yeah.
For listeners, that's a great thing to, and myself.
Yeah.
Yeah.
Right. Yeah. Yeah. Absolutely.
I love that.
well, and just knowing as well, because it's so easy to just keep climbing this perceived ladder that you think is in front of you, and it's like, well, if I've done this, the next step next logical step is this and this and this. And yeah, I'm so grateful that I got to that, because I still get emails from search groups that are looking for a dean of another veterinary school, and it's like,
Yeah.
hey, thanks for reaching out. That's really nice that you're even the least bit interested. I know I don't have what you need.
Yeah.
I know that.
Yeah.
That is not my thing. I am not good at getting people who don't want to be better to get them better.
Yeah.
I do a pretty decent job in helping people that want to improve, but that's
Yeah.
my strength, not
Yeah.
the other way around. And so good luck. You'll find someone that's your
Yeah.
right person.
Yeah. They need the right person. Yeah.
Wow.
Oh, that's cool.
That is so interesting.
Well, what is next for you? I guess. What are
Yeah.
your? I mean, you'll probably do a check-in soon, but you don't have to give us that information.
Yeah.
Just, I mean,
You still have a couple weeks to do
Yeah, I still
your
got some time.
check-in. Yeah.
I mean, we're in the midst of developing a new curriculum here, and I've taken the lead on the surgical skills side of things. So
Wow.
I'm excited about that. We have built what I think is an incredible year 1, 2, and 3 surgical skills program. We want to move that into the 4th year as well. I mean, Chelsea, right? You do all this training and then you go to 4th year, and it depends upon the surgery and who you're on with, whether you actually do anything. Besides stand there with your hands clasped, not making a mistake.
Yep.
And so one of the things I'd love to design is a polishing rotation. So in the 4th year curriculum, bring the students out of the general surgery, whether it's small animal, large animal, equine, and bring them into the lab and polish skills again. So keep building on those. So that's probably the next step. We've got year 1, 2, and 3 pretty well done. My goal is to help us to figure out how we can help them with year 4 and do that. And then if the world were perfect, what I'd love to do is design a 2-year continuing education program after veterinary school that continued to build on those skills. And we did a Delphi, and I'm not sure if you're familiar with those or not, but it's where you take this concept, and in ours, in this particular instance, we said, what are the things we think students need to be able to do when they graduate from CSU from a surgical skills perspective? We found 60 veterinarians, 30 who had graduated within the last 5 years, and 30 that hired veterinarians that have graduated in the last 5 years. And we asked them whether they agreed with us, whether we had the right skills down, large animal, small animal, mixed. And then you look for an agreement. So they rank them 1 through 7. 6 and 7 are everybody agrees with, and so those stay on the list. 1 and 2 are ones that almost nobody agrees with. They come off the list. And then the 3, 4, and 5, you come back and do another view. So we ask them, what do you think? And then what did we miss? What did we not have on there that we should have had on there? And then we send it back to this group for a second time around. And at the end of it, you eventually take your 6 and 7s, which are the ones that the vast majority, so 75 to 80% of the people agree on, and that's what you train. So we
Okay.
built the curriculum to fulfill that.
Okay.
Wow.
Wow.
So what I'd like to do is do the same thing for year 1 out and year 2 out.
Yeah.
So what are the things you think they need additionally to that? So whether I'll get to it or not, I don't know, but that's my
Okay.
goal.
I
My
love it.
hope is that we can put together the 4th year polishing, and then eventually perhaps 2 years after graduation CE opportunities.
Yeah. I mean, I know even in the old curriculum, I felt like quite capable, I guess, leaving,
Mhm.
especially with junior surgery and different things that
Yeah.
have all changed a bit. But it's just, yeah, I think it's great that it's constantly evolving and improving. So that's so exciting.
Yeah.
Yeah. And we're just trying to be more purposeful about it. I think you're right. I don't think you guys, I don't feel like we have ever graduated a student who could not have been comfortable, confident, and competent in the basic surgical procedures. But what we're finding is that not everybody got there. You could have, but
Okay.
not everybody did.
Not
So we're
everybody
trying to build something that has more reinforcement of skills and more principles based.
Yeah.
So you don't think of doing a splenectomy,
Yeah.
you think of doing an ectomy.
Okay.
So this all came about. I was doing a lion surgery and happened to be an enlarged spleen. And I had one of our students with us, and they asked me, how many splenectomies have you done? Because it was a spleen, going to take the spleen out. I said, well, including this, I've done 2. One on a lion and one on a horse, because that's
You
not
don't-
something we do.
You don't
We
take them
don't do
out.
splenectomy.
Yeah.
But I said, I've done 10,000 ectomies probably. I don't even know how many ectomies I've done. And we took a step back and realized we'd been training our students how to do a splenectomy.
Yeah.
Now, many of the students figured out that's an ectomy. I can do a splenectomy. I can do an ovariectomy. I can do a nephrectomy, whatever that is. But the rest of them could only do a splenectomy if they'd done a splenectomy.
Okay. That makes sense.
And so we've changed our whole mindset to teach them how to do ectomies and otomies. And then we keep telling them, hey, look at this. What would happen if you were presented with X? And they're like, oh, well, I would find how it's attached to the body. I'd find the vessels, I'd ligate them, and I'd remove it.
Right.
Yeah.
Like, there you go. That's an ectomy.
Yeah. There you go.
Yeah.
Yeah. So I think that part's exciting and fun to do that. And then just seeing how we can use simulation to give people time after time after time.
Yeah.
I will tell you, one of my favorite memeries of Chelsea was actually we were in the midst of building these models, and we were developing a surgical skills thing, and CSU Technology Transfer had wanted us to get a video of a student using this, and it was really early in the prototype days. And Chelsea was on clinic, and I said, would you please just come do this and let us do a video of you? And so it was a bleeding body wall. So it had vessels impregnated into it, hooked up to simulated blood, all draped. Chelsea's gowned and gloved, and she cuts into it and it starts to bleed. And I was watching your eyes. Everybody else was watching your hand, and your eyes got so big. And it was like, we've done it. This is an accurate simulation. This is somebody who's close to graduating, one of our best students, right? So I picked one of the best to do that. And I think that's the other part for me is it's our opportunity to use simulation whenever possible for repetition. So you can do it 10 times versus 1 time and get better and better at it. So
I remember, even in those days, I remember that simulation, and I remember it bleeding.
It's a core. It's locked in there now. It's a core memory.
I mean, it felt real. So
Yeah.
I mean, the more you can do on that side, because you're right, it is repetition, and I don't think 4th year is a given, And so, and there were some of those transfer students, right, that maybe didn't have. I felt like they had a lot of field surgeries, but they maybe didn't have a lot of, like models and simulations and an opportunity to practice surgical skills.
Yeah.
So it's just
outside of that too, when you were talking about the 2-year just CE afterwards, we've had a lot of conversations with other veterinarians too, just after they are, graduated and in the real world of things. Some of them, depending on where they were, felt isolated without like an extra mentorship, right? Like somebody that they felt like they could call. That was it's probably going to be so useful if you guys do that, just so they still feel connected while they're out in the real world, because it's different when you're surrounded by peers and all of that in school. And then you go out into the real world and you're kind of like, so if you have that connection with them, you know, I'm sure that will improve.
Well, and that's exactly right. I think through year 3, I felt in practice, it was years 1 to 3, even with an equine internship, private practice, but 1 to 3, first to third years were the most like clinical skills challenging. And then after that, I felt like with whatever book I had or anything I had to look up, I could master or at least delve into things that I hadn't done before without feeling nervous.
Yeah.
You know?
Yeah.
And just be able to read
and
and use your skills. Yeah.
Yeah.
So that'd be great at CE at 1 and 2 years.
Yeah. It makes you wonder whether there's would be some benefit of having almost as you said, a mentoring program for when you're gone, just a regular check-in. Because I think one of the biggest challenges is, you know, I mean, I tell people this, nobody has graduated from CSU that hasn't heard from me. Call me, send me an email.
Yeah.
I am happy to support you in doing whatever, but you get busy. Everybody gets busy and they get doing things. And I think sometimes they don't think about that. It makes you wonder a little bit whether or not there could be almost a mentorship, a planned mentorship deal that, you know, we're going to connect once a month. Just even if it's a 5-minute, how you doing? How's everything going? That sounds I think that could be really cool.
Yeah. And that might make them more comfortable too, that even if a year passes and you don't talk to them for a certain amount of time, that they just know, like you said, that they can just call you and be like, oh, I see, I have this case. Never seen it before in my whole life, you know, and I'm, you know, it's might help them just be more comfortable to just pick up the phone. That might be cool. Yeah.
That would be very cool. Yeah. Well, thank you for your time today. This has been enlightening. And,
That's fun.
A delight.
And what a great career you've had. It's just great that you've been able to share it with so many people and teach and bring everyone else along.
Yeah. Thanks for everything you do.
Yeah.
Thanks. I think I will see this spring my 5,000th veterinary student walk across the stage.
Oh,
5,000?
That give me chills.
I know.
5,000.
Wow. Oh my goodness.
Crazy. Wow. That's very cool.
Well, thanks for everything you do for the profession.
Yes.
Yeah. Oh, it's a pleasure.
Definite inspiration. So
cool. Okay. All right. Thank you. And happy holidays.
Yes. Happy holidays.
Great. Thanks. Yeah. You guys too.
Okay.
Thank you.
Okay.
Take care.
Bye.
Bye.
Thanks for listening, everybody. We would really love to have you as a guest on our podcast. So if you have any fun stories to share with us or would like to be a guest, we have a form on our website. So unhingedandOnCall.com. And you just click on the little link there and you can fill out a little bit about your story and yourself, and then we would get back to you. Or you can just email us to chat@unhingedandOnCall.com and just tell us a little bit about yourself. And we would love to have you as a guest.
We also are looking for ratings. So essentially on Apple, Spotify, wherever you get your podcasts, you can rate and review our show. And that would be super helpful in just getting kind of into the algorithm. And then additionally, we are on YouTube. So if you ever want to watch videos, we put more content, like visual content, so pictures, videos, things like that, into the episodes. So we'd love to have you follow or subscribe our channels on YouTube.
Yeah.
Thanks for listening.
Thank you.
Thanks for tuning in, and make sure you subscribe so you get all the latest updates. Unhinged and On Call isn't just a podcast. It's a lifeline for every veterinary professional barely holding it together with vet wrap and caffeine. Somewhere out there, another tech, vet, or assistant is deep in the same chaos, dodging poop, managing meltdowns, and wondering if they're the only one unraveling. You're not. Whether you're laughing, crying, or rage cleaning your truck, you've got a whole tribe behind you. You're unhinged, but never alone.